Chicago will get 100 to 150,000 vaccine doses by the end of the year. First responders, frontline healthcare workers, and people living in long-term care facilities will be the first in line to get the shots. Vaccinations for people in the general population will begin sometime in the spring or summer. Registration has already begun in Illinois for people who want to get the vaccine.
Joining us now is Dr. Susan Bailey, the president of the American Medical Association. Good morning.
Good morning. Thanks for having me.
Do you find that medical professionals who are first in line to get this are open to actually getting it?
Yes. Medical professionals have been waiting for this day when we could see the actual data about the vaccines along with the FDA. And physicians are scientists first, and so we like to study the data before we make conclusions. But today is really a historic day, and I know that medical professionals are very anxious to line up and get vaccinated against COVID-19 and help bring about the end of this terrible pandemic.
How is contract tracing working? We heard that that was the way to stem this problem, but it seems like a task that's just undoable.
Contact tracing has been incredibly difficult because we don't really know the full extent of people that have COVID or very early COVID, but have not and are spreading it to other people, but aren't aware of it. So it's impossible to contact trace in that situation. We think it's so important for people to double down on wearing masks, washing hands, physically distancing, and avoiding indoor gatherings when possible to help stop the spread of the pandemic.
What about children and vaccines? Is there enough information out there? How necessary is it?
Children were not studied in the initial vaccine trials, so they will not be recommended at first to receive the COVID-19 vaccine. Pediatric studies are being planned and will eventually be available. But right now, since children don't seem to be as much at risk for severe COVID-19 disease, although they certainly can contract it and they can spread it, they're not going to be in line yet to get the vaccine.
So I think people want to know, when is the average person who might not be at risk going to get the vaccine, and when do you see us all walking around without masks again?
Oh, gosh, isn't that a wonderful thought? I believe that the general public who are not in healthcare and don't have particular risk factors will receive vaccines. We're thinking second quarter, late spring, early summer. There will eventually be, we hope, plenty of vaccine to go around. And for now, we still need to be very vigilant about wearing masks and washing hands and keeping our distance, especially with the holidays coming up. But hopefully later next year, maybe we'll be able to start relaxing on some of these things and trying to get back to what we think is a normal life.
All right, Dr. Bailey with the American Medical Association, thanks for joining us.
Thank you for having me.